Hi, and welcome back. I'm Dr. Melissa J. Williams, and I'm the Administrator for Partnership for Health. We're a private home health care agency located in Georgia. So today what I want to talk to you guys about is Medicare. So clients call our office every day and they're looking for service. Some of them have Medicare and some of them have Medicaid, and some clients don't have insurance at all. So today what we're going to be talking about is Medicare. So if you have Medicare, this video certainly will be for you. And if you have Medicaid, just refer back to a previous video that I did that talked about the difference between Medicaid and Medicare. So what is Medicare? Medicare is a federal insurance program for individuals that are 65 or older, and also under 65 but receiving SSI or Social Security disability insurance. So at the time that I'm recording this video, there are commercials that's bombarding, I'm sure, your television, and it's talking to you guys about Medicare, and that is open enrollment for Medicare. So you guys know that over 10,000 individuals turn 65 every day in the US. So with our population aging, a lot of people are concerned and they're trying to figure out what is Medicare, and or a lot of people are getting ready to turn 65 and they're looking forward to receiving Medicare. Now remember, Medicare is a federal insurance program that's for individuals that are 65 or individuals that are under 65 receiving SSI. Okay, so who's eligible for Medicare? All right, so an individual will be eligible for Medicare if they are a U.S. citizen or if they are a resident of the U.S. and they've lived here for 5 consecutive years. All right, so there's different pieces to Medicare, and it could seem a little confusing at first, but hopefully, like I said, this video will help to kind of make it a little more easier to understand. All right, so if it's yourself that's turning 65 and you're getting ready to get on Medicare, this video should be helpful for you. And or if you are assisting a loved one or a family member that is turning 65, this video is for you as well. All right, there's 2 different ways that you can get Medicare. Okay, so traditional Medicare has Part A and Part B, and then you can get Medicare Advantage. So I'm sure you're probably hearing commercials about Medicare Advantage. Okay, so let's break down the difference between the two. All right, so you got traditional Medicare, which is Part A and Part B, or you have Medicare Advantage. All right, so let's talk about traditional Medicare. With original Medicare, you have Part A and Part B. All right, that may seem confusing, but with original Medicare, there's Part A and Part B, and so we're gonna break that down. All right, let's talk about what is Part A. All right, and so let's think of Part A as the building or the hospital, and Part B is going to be your people, or let's just say the doctors. All right, so Part A is the hospital, Part B is your doctors. All right, and then with original Medicare, you also have supplement. All right, so a supplement helps you to cover what Part A and Part B does not cover. All right, so it kind of helps you to reduce your out-of-pocket costs, if you will. What does Medicare cover? So it's probably easier for us to talk about what Medicare does not cover. And so if you would, I've listed several items that Medicare does not cover, and you can kind of look at those and read through those. All right, but for the most part, Medicare will cover your hospital visits, and it also will cover your doctor's visit. Medicare covers all of your necessary medical procedures. All right, it does not cover dental, cosmetic surgery, and actually I listed what Medicare does not cover on the next slide. So you can look at those. Medicare covers all of your medically necessary procedures. All right, so that's what's important here, is that Medicare does cover all of your necessary procedures. Okay, so now that you know a little bit more than hopefully you did when you started watching this video about what is Medicare, now the next question you may ask is, how do I get started? All right, what do I do? If you're turning 65, or remember, also if you're receiving Social Security or SSI, what you need to do is you need to either call or you can go online and visit the Social Security Administration. All right, and what I've done is I've listed the telephone number on the next slide. And when you do, you are automatically going to be signed up for Part A. And remember, we talked about Part A being the hospital, okay? But you do have to call and or go online in order to initiate Part B. All right, and remember, Part B is your doctors. Part A is automatically gonna start no matter what, but Part B is optional, okay, and it does come with a premium. All right, so you do have to go online or call in order to initiate your Medicare when it's time for you, okay? All right, and so some of you may already have insurance. You may have insurance with your current employer. And so what you're gonna be doing is you're gonna be replacing your old insurance with your new insurance, your Medicare. All right, so what you're gonna do is you're gonna decide how much insurance you need. Okay, and the way you determine that, you look at your current or your personal situation and you can determine if you need just Medicare Part A and B and a supplement, or if you need more insurance, then you may want to choose, like we said, we have two options. You may want to choose that second choice. A Medicare Advantage plan is for folks that may need more coverage than Part A and Part B. Okay, because remember, Medicare Part A and B and a supplement comes with your original or your traditional Medicare. So a Medicare Advantage plan gives you a little more coverage than your traditional Medicare. Okay, so with your Medicare Advantage plan, you will be actually choosing an insurance carrier. Okay, and there's several out there. United Healthcare, Aetna, there's several. So what you're wanting to do is you're wanting to determine which plan, okay, which Medicare Advantage plan is going to be best for you and your personal health situation. So if you choose a Medicare Advantage plan, you will choose an insurance carrier, and that insurance carrier will take you off. Just say if you're on traditional Medicare or original Medicare, they will take you off of your Medicare plan and you will then join their network of doctors and hospitals, all right? So you may want to do a little research to find out what doctors, what hospitals are in your area for the different types of services or specialties that you may need. If you have original Medicare, then you're gonna go to your doctor or your hospital, and you can go to any doctor or any hospital just as long as they accept Medicare. Now, if you have Medicare Advantage or a Medicare Advantage plan, then that is a little different because then you're in what they call like a network. And so you can only go to doctors and or hospitals that are in the network. With a Medicare Advantage plan, you will also probably find that your premiums are very, very low, or they're lower. All right, your premiums may be lower, and you may not have premiums at all with the Medicare Advantage plan. If you have a premium, there's some things that you need to know. There's a couple of terms that we're going to go over briefly so that you kind of understand what your responsibility will be. All right, so we've got a couple of terms we're going to talk about. We're going to talk about cost sharing. We're going to talk about insurance premiums. We're going to talk about co-pay, and we're going to talk about co-insurance. Got it? All right, so what is cost sharing? Let's talk about that first. So cost sharing is when you share in the cost. So you may have a premium and you're sharing in the cost for your insurance or for your medical services. So you may have a premium for your supplement plan or your Medicare Advantage plan. So with a premium, what? You're sharing in the cost. Your insurance premium is the amount of money that you pay for your insurance policy. That's what your insurance premium is. Copay is a fixed amount that you pay to your provider before services are rendered. All right, so copay. So sometimes you may go to your doctor and you may have to pay $5 copay. All right, so you pay that up front before the services are rendered. Co-insurance. Co-insurance is the percentage of costs that you pay after you've paid your deductible. That's just the brief synopsis on Medicare, all right? So the reason I chose to do this video is because so many people call our office daily and they're looking for home health. If they don't have the right insurance, they may have to pay out of pocket. So it's very important for you to understand the difference between Medicare, Medicaid. If you or your loved one needs home health care services, does Medicare cover services that you or your loved one may need? Or does Medicaid cover the services? Or, all right, do you have to pay out of pocket? All right, many families may have to pay out of pocket. So this is a short video. Like I said, there's a lot more to talk about and to discuss with Medicare, but this was just a brief overview of the difference between Medicare and the difference between the two options that you have, right? You have the traditional or original Medicare and or you have your Medicare Advantage plans, all right? So hopefully, like I said, this was a helpful video. If you liked it and if it was helpful, please give us a like, subscribe to the channel, all right? And stay tuned as we talk about your health and we talk about things that's going to be important to you and your family. This is Dr. Melissa J. Williams. I am the administrator for Partnership for Health, and we're a private home health care agency here in Georgia. All right, so take care and stay healthy. Until next time, we'll talk soon.